Good evening, everybody, and welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny. My name is Councillor Patrick Canavan, and I'm going to be chairing this meeting this evening. And the first item is I'm going to ask the Democratic Services Officer if she would read the housekeeping notice, please.
Thank you, Chair. Please note that this meeting of the Health and Adult Social Care Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chairman. For those in the room, please note that if a fire alarm sounds, please exit the building by way of the nearest available signed exit route and make your way to the surface car park at the front of the annex. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Thank you very much indeed. And do we have any apologies, please?
Yes, Chair. Apologies for absence have been received from Councillors Allen and Edwards.
Thank you. And substitute members?
Councillor Rampton is substituting for Councillor Allen.
Thank you very much indeed. Somewhere online, I think we have Councillor Edwards, so hopefully she'll be able to hear us. Welcome, Councillor Rampton. And we're going to move then on to declarations of interest. So if any committee members have any declarations of interest, I would be grateful if they could indicate now. Councillor Carr-Brown.
Thank you. I have the usual declaration of interest that my husband, do I have to repeat it each time? Yes, sorry. My husband is a non-executive director on the Independent Care Board for Dorset, and I am a support worker to an autistic man who is in receipt of direct payments from BCP.
Councillor Salmon.
So I still work for Dorset Healthcare as well. Wasn't sacked over the Christmas break.
Bonus then. Councillor Matthews.
Thank you, Chair. Yeah, this relates to item 6, although it doesn't specifically refer to the Alzheimer's Society. My wife does actually work for the Alzheimer's Society, who do provide some provision throughout Dorset. So I just thought, for clarity purposes, I ought to declare that. Thank you.
Thank you very much indeed. We need then to get confirmation of the minutes, please. So unless anybody indicates otherwise, I'm going to take it that the minutes of the meeting held on the 27th of February are accurate. Councillor Edmund.
Yes, I'm so sorry, Chairman. That last comment about wives working for something. Oh right. Oh, should I declare that I'm a board member of the Age Concern Christchurch UK because they provide friendship groups and things? Was that the point?
Yes, and thank you for that declaration.
Yeah, okay, thank you.
Thank you very much.
Well, and also then, in that case, also a board member of the Christchurch Housing Society, which ditto provides those sort of things.
Thank you very much. I'm very grateful for that. So as I say, if we could then get confirmation of the minutes, please, for the 27th of November. Everybody content with those? Thank you very much indeed. And again, the action sheet, unless anybody has any particular issues, we'll take. And then when we get on to the forward plan, we'll probably have a bit more of a look at some of those issues. Is that okay? Everybody content with that? Thank you very much. Public issues, please, Louise.
There are no public issues, Chair.
Okay, we now move on to item 6 on the agenda, which is the Day Opportunities strategy. And I'm going to ask Karen Giddings to present this in a moment. But just for the purposes of anybody who is tuning in, I just wanted to clarify that this item on the agenda this evening is just to get an update on the current status of the project and to remind everyone that the next Health and Adult Social Care Overview and Scrutiny Committee on the 4th of March, we will be considering the final draft of the strategy, including the consultation results and what, if any, changes have been made as a result of that, and also obviously the report that will then go forward to Cabinet. So that would then be with a view for us as a committee to be able to comment on that and to advise the Cabinet of any views that we might have, and they meet on the 6th of March. So if there is anybody who wants to come to address the committee at all, then the 4th of March would be the ideal opportunity to do that. So with those remarks, Mr. Gillings, please.
Thank you, Chair. If I can just share a PowerPoint presentation with all. Is that all clear to everyone?
Yeah, that's great. Thank you very much.
Thank you, Chair. Thank you for inviting me. My name is Kevin Gillings. I'm the Commissioning Manager for Day Opportunities for BCP Council. I've been in post since March 2022 and been tasked with developing a draft Day Opportunities strategy, which I want to go through with the committee tonight. Just to be clear, day opportunities can mean different things to different people. They can be around a whole range of learning new skills, taking part in a wide variety of hobbies and interests, accessing the community. It also is about employment and voluntary opportunities, and very importantly to people, developing friendships and support networks. Just to be clear, the term day opportunities will be used when referring to all potential activities, as just mentioned, as opposed to terms such as day services, day centres or day care, which have an association with a more traditional provision of building-based services, which are specifically built to provide day services within. So our strategy, we developed key themes for the strategy. First and foremost was about co-production, which was really involving people in making decisions. We put together a large co-production group in June 2022, which involved people who use services, carers, providers of services, a range of advocacy services, also our partners in the NHS and other local authorities that neighbour us, and councillors have also been involved in that co-production group. Underpinning the strategy as well was very much about a strength-based approach, which was very much looking about what people could do rather than what they couldn't, and an asset-based approach as well in terms of utilising the resources that we have within our community, including those day service buildings. It was also about being innovative and looking at maybe different ways of doing things and providing services, which would lead to market shaping within our communities, and also importantly had to be sustainable within the budget that is given to day opportunities. So we were engaged in lots of project work over the last couple of years. We did a data and needs analysis work as well, getting lots of information about day opportunities in the area and beyond. We also worked with lots of other local authorities to learn from their journey. And we also engaged in a questionnaire which went out to the public at the end of 2022. And all of the information that we gained from that and discussed within our governance groups, including the co-production group, we agreed 6 overarching design priorities, which had 25 proposals within. And just an overview of those 6 priorities were about a day service review. The information we got back from all of the work of the project very much supported a mixed model of day opportunities, so having traditional day service buildings alongside community provision. What we wish to do as part of the day service review priority is to develop those community-based activities, and by community-based we mean normally smaller organisations that are in the community, often hiring venues within the community to provide their services, and micro provision, which is very similar in terms of smaller organisations of up to a maximum of 8 employees or volunteers, and looking at developing micro providers in our area, as many other authorities have done with quite a degree of success. We also wanted to look at hubs that will ensure a safe space for people who require a building-based service, acknowledging that some people will absolutely need a building-based service and the community may not provide for all of their needs, but as well as making sure that those building-based services were community assets for a wider group of people. There was a particular focus as well on younger people transitioning to adult services, as younger people coming through are not always wanting to take up placements in more traditional day service buildings. And we needed to look at innovation, looking at potential of digital options, which some appeal to some people, and also looking at specific services for marginalised groups who aren't well represented in our current day opportunity provision. The second priority we identified was supported employment review. We wanted to enhance the offer of paid and voluntary work, and we wanted to work with our communities teams, particularly in regards to their volunteer strategy. It was found really that some of our current offer appears more like a day service rather than a supported employment opportunity. And therefore, we wanted to make sure that we've got a targeted employment offer for those people who wish to gain paid employment, and indeed voluntary schemes as well for those people who may not be ready for paid employment but wish to gain the skills of employment and aspire to that. Day opportunity standards and support was very important to our co-production group, and in terms of developing a charter of standards, which we don't currently have for day opportunities. We also wanted to create a forum for day opportunity providers so that they can come together, work together and learn from each other. And we wanted to ensure that we have quality assurance processes to make sure that the day opportunity that we provide are of good quality, and that is backed up by the data that we hold. Transport was an issue to people in terms of getting to and from services, and we want to look at enhancing the travel offer, including travel training, looking at voluntary schemes to assist people to and from services, and creating more local services for local people to negate the issues of transport. Cost and eligibility of day opportunities also came up as a priority. Many of the people who responded to our survey very much enjoyed the day opportunities that they engaged in, but weren't able to do more because cost was prohibitive. And we want to therefore implement a framework for day opportunities charging, which we currently don't have. We wanted to review the needs assessment for accessing day opportunities. And we also want to look at facilitating access to personal budgets so people have choice and control of the services that they access. From our survey work as well, accessible information was another priority identified, as many people did simply not know what services were out in their local community. And therefore, we want to work with our information and advice team and providers to have up-to-date information on day opportunities available to all in a variety of formats. So those were the 6 priorities we looked at. We looked at also the cost of current provision. And we looked at, as mentioned earlier, community-based services, those smaller services from normally independent providers. And we looked at the average cost of all of those services, and that came up at £9.51 per hour. When we looked at independent day service buildings outside of our Tricuro portfolio, which I will come to in a moment, the average cost, there was a range, but the average cost came out as £10.40, with a range of anything between around £8 to £15 per hour, depending on need. And then when we looked at our Tricuro day service buildings as our local authority trading company, who currently manage 8 day services, 5 are called plus services, which are for specific needs, such as older people who may have a dementia diagnosis, people with complex learning disabilities, and people with a mental health issue. And 3 connect services, which are larger day service buildings, which are open to a range of need. Our current block contract, when we looked at the number of people who accessed these services and how much that block contract amounts to, came up as a much higher figure of £24.64 per hour. So looking at the future of day opportunity provision as identified in the draft strategy, we want to provide community-based provision that will be needed for the modernisation of day opportunities. And there is work in progress on developing micro providers, as mentioned earlier, that have been developed by many other authorities and have good outcomes for people, as well as providing a greater choice of service. And we also want to look at individual service fund development as well. Individual service funds are really lie between commission services on one hand and direct payments on the other, and essentially are about an independent provider assisting individuals with accessing and the payment of their services, as they may struggle to manage a direct payment themselves, but it still provides the choice and control to access the services that they wish to. So we wish to work with local communities to develop that micro provider market. We wish also to review potentially individual packages of care and explore with people what the options are to access more community-based day opportunities where that's appropriate. And we want to develop those individual service funds and enhance the direct payments that people access in order that people can have greater control over how they purchase their care and support. As a result, we put out a consultation on the draft day opportunities strategy on the 1st of December for a period of 6 weeks. And that also had some council-led proposals in regards to closures of services from the Tricuro portfolio that I mentioned earlier. So proposal 1 was looking at closing Tricuro's 5+ day centres and increasing community provision. Currently 3 of those plus centres are already based in the Connect centres on the end of COVID in 2021, or the reduction of COVID infection, I should say, in 2021. And when services reopened, 3 of those plus centres went into the Connect centres, so there will be a negligible change for those provisions, and 2 other plus services of Pool Plus and More Down Plus for older people with a dementia diagnosis would also be reviewed for consideration of closure. Proposal 2 was very much financially driven and was not part of the draft strategy in terms of having a mixed model of day opportunity provision, and that was a proposal to close all Tricuro's 8 day services and provide support to those with an eligible need in alternative provision. So the timeline for the project is as follows. We have held drop-in sessions earlier part of this month, which have been well attended in the 5 open services of Tricuro and have been out to the public as well. The consultation ended on Friday, the 12th of January, but we are continuing to collect questionnaires from people, and we've had a really good response already in close to about 600 completed questionnaires, and a lot of other representations as well from people, which we are including in the consultation report, alongside previous engagement that we've been involved in with the 5+ services, where we have specifically earlier last year now went out to those plus services, engaged with people who use the services, carers and the staff teams to get their views. All of that will be collated into a report in the next 2 to 3 weeks and be provided at near the beginning of February. We will then prepare option papers for an equality impact assessment about all 8 of those services, which will then come to overview and scrutiny and cabinet in early March. But we will prepare those papers during February, and we'll update and gain input from the project groups, including the co-production group, in February. Those papers, as I say, will come to overview and scrutiny and committee in March, and in April, if required, and if there are additional savings of over £1 million for any potential closures of services, then that would require a full council meeting on the 23rd of April. From May onwards, it will be about planning and implementing end of decision by Cabinet, and if any services were to close, this would be implemented in a phased and considered manner, understanding that that would have a significant impact on those individuals who access those services. So that concludes my presentation. Thank you very much for listening, and I'd like to put it out to the floor, Chair, for any questions. Thank you.
Thank you. Thank you very much indeed. I'm going to ask for any questions, but if I may just point you towards directions of clarification on the update. And when we come on to the forward plan, I'm going to ask you to reflect on the amount of time which we think we might need on this item, given that it's a fairly weighty item. And I think that's when some of the more critical questions might want to be asked, but I'm not wanting to stop anybody from asking any questions. I'm just flagging that up. Any questions, please? Councillor Salmon.
So I did chuck my questions to you by email, but very short notice yesterday. So I'm not sure if you've seen them yet. I was just very curious what I mean, I use the term patient journey, but it's probably the wrong terminology. It sounds almost more like service user journey. And I couldn't see that mapped out. And I was wondering if that existed as part of this analysis, because I think that would be good to get eyes on. It also sounds like there's a fairly small identified cohort of users for these various day centres. And I was wondering if there was, and I might have missed it, because I've missed a couple of things in the report, if there was just a really basic heat map of where people are coming from to access these day centres. I think I might have missed it, but that average hourly cost that showed Tricuro, I think, was it coming in at double the hourly rate? Was it more than double? I must have missed that in the original report, because I think I would have questioned that, because that stands out to me, and I'd like to understand why it's so much more. I know the More Down Plus is very dementia care focused, and I wonder if it was just not all of these day centres are created equal, and if that was the explanation. Then there was just one other thing. Yeah, hourly cost. No, I tell you what, that's it. That's my starts for 10. Sorry to bombard you with all that stuff.
Are you okay to answer those?
Yes, I just those questions. Thanks very much, Councillor Salmon, and also for your email, which I did receive and haven't had a chance to respond to you on that basis. But thank you for that. We have been provided through recent consultation. Coming back to your first question about the patient or service user journey, we have impact statements as well for individuals, which we've been gathering as part of a consultation as well. We also have specifically engaged people last year, as I mentioned, in June and November. We went out to all of the 5+ services. We spoke with individuals about their needs and wishes and the future of day opportunities as well, and gained that direct feedback as well, which was very powerful. Our engagement sessions as well have very much included people who use services, and we have had advocacy within the meetings that we've had with day services as well to ensure that people's voices are heard. And so, yes, we do have that information in terms of the impact it could potentially have of changes to services on individuals. I'm just trying to go through your points, and I think secondly you mentioned about this fairly small.
Yeah, heat mapping the location they uses to the various day centres.
Yeah, so we did do some analysis work as well about the free reprovisioned plus services as well. We looked quite intensely at that, and that's in our data and needs analysis report in regard to where people had travelled to as well from their previous base to their current base, and there was really found to be a fairly negligible difference between the two, and we have looked at that for the other plus services as well as part of proposal 1.
But is that included in this report and I've missed it, or does that live elsewhere and we've not had eyes on it yet?
I think it was provided on our previous attendance in March of last year with the papers that went for the Case for Change report, which was agreed by which was run past overview and scrutiny, and I can provide that with that as a public document in terms of our data and needs analysis, and has that information within.
If that is something that you could recirculate, that would be really helpful. So thank you very much.
Certainly.
Councillor Rampton, and then I'm going to take Councillor Edwards after that.
Yes, thank you, Chair. And obviously I was involved previously with the co-production group. I was really concerned when I read and completed the consultation on these proposals, because it reads as an either or. It's clause 5 or clause 8. and there's no sort of third option. And I think actually that's a bit sneaky. No offence, Kevin, but I really do think I can see that there is, of course, a need to make significant savings. But it does actually cost quite a lot of money to keep people safe, doesn't it? So to talk about closing the day centres, I've had a lot, I'm sure we've all had a lot of contact from residents who are really, really disturbed at this. And of course, those proposals were not, as it says in the paper, the co-production group were not involved in discussing those two proposals. I'm really, really very concerned about that. Because the consultation was held over Christmas, there hasn't really been that opportunity for people to engage as much as they would have liked to. And again, the People First group in particular are very concerned that they haven't had that opportunity. And I understand that they did message and ask for an extension to the consultation period, and that was actually refused. So I think in the spirit of co-production, I think that's really unfortunate. I just think that there's a lot in this paper that really concerns me. And some stuff I did bring up at the co-production group, the bit about not knowing how many people who have a direct payment are actually using it to access a day opportunity. I really do think that we should know that. We're talking about providing services in a different way, and we should actually know what people are doing with the money and what's out there. And I would really like to know if the market has been tested. There's a lot of talk about micro providers, is that the term, and so on. But has the market actually been tested to make sure that the provision is out there to provide an alternative provision to people? Because you are always going to need buildings-based day services for people, and it's not just for the people who need the services. It's for, we know this, it's for the carers as well. At the moment, if somebody's loved one is collected or taken to a day centre, it's providing respite to that person. And I think the cost, the human cost in doing something as dramatic as closing down 5 or the 8 would have repercussions. I think you're kicking the can down the road, and there'll be repercussions later on for those people in terms of perhaps people needing to go into residential care because carers are not able to cope. So there's a great deal that concerns me. But what I would like to see, and I'd like to, if I may, Chair, is to suggest a recommendation to add to 1 and 2, which is to allow a further period of time to allow the co-production group to discuss the proposals. And I think that's absolutely fair and reasonable. And I'm looking for a seconder, please.
Happy to second that.
Thank you.
Thank you. Would like to respond to that, please?
Yes, if I may, Chair. Thank you. Thanks, Councillor Rampton, and your involvement in the earlier stage of the project was really valid. And I want to thank you for that. We have arranged as well a co-production group meeting next week on the 24th of January. And we have set aside time within that co-production meeting as well to discuss the consultation on people's concerns, which will also be fed back into the consultation report as well, to allow that. As you're aware, very much so through developing the draft strategy as well, it was very much about that mixed model approach as well, and about the value of day service buildings as well, and that's very much what the draft strategy purports. The proposals that have come in since then, we wish to do that in a more leisurely pace in terms of looking first of all at the free reprovision services, and then potentially moving on to other plus services and reviewing those as to whether they are needed for the future. But it was very much a financially driven a viewpoint from the proposals 1 and 2, in terms of looking at that, and we were directed in that regard, and it is not as you say, in keeping with the strategy and the draft strategy, or having been co-produced as well. So I accept that point. We have also made it very clear to people during our engagement sessions as well, and in communications as well, that no decisions have been made, and there could be the option potentially of part of proposals. But we do accept, and we've heard back from feedback from people within drop-in sessions, that it felt a more binary choice, as you mentioned, between closing all 5 and closing all 8. But we've made that clear to people that that's not the case, and therefore we will be doing individual assessments of each of the 8 services for individual decisions on those 8 services to be made.
Chair, may I just briefly come back on that, please? Thank you, Kevin. I'm really pleased that I was aware there was a meeting next week of the co-production group, and it's great that it's going to be discussed. I think the issue for People First was that because it was held over Christmas, because there was a problem with people accessing the easy read version online, that the people that they go out and meet with weren't really able to have their say. So it's all very well the co-production group represented by those people next week, but they haven't had a chance to go out and engage with the people who are not part of that group. So that is why I'm still asking, please, for an extension to the consultation. Thank you.
Do you have any comment before I take any other questions on that?
I would just, if I may, Chair, I would just say that People First Forum were involved in the engagement sessions at the free Connect centres, and so have been supporting people to complete questionnaires. The questionnaire return that we have had so far, and we are continuing to collect those and take in responses, which will feed into consultation as well, continues over this week. So they have had involvement, and they've been really helpful in assisting people to complete questionnaires, which we offered.
Okay, I've got some other questions that I need to take, but Mr. Hornsby.
Thank you, Chair. Just to respond, Councillor Hampton, on the easy read elements. So the easy read link was working all the time. What People First Forum asked for it to be made more prominent on the landing page. When that was done, there was a problem with that link, and so that was fixed within 3 days. So it was a short interruption on that, but you could access the easy read version all of the time. Just didn't jump off the page at you.
Okay, I haven't forgotten about your proposal, but I've got a list of people who have indicated that they'd like to ask questions. Councillor Edwards.
Thank you to lower my hand, because Councillor Salmon and Councillor Rampton have asked similar questions to what I was going to ask. Although I just want to make the comment that I'm a little bit worried about the More Down Plus, because it's very specialised for dementia users, and we know a lot of dementia users, they really don't like any change at all, and if they refuse to go to a different place or a new place, that has a huge impact on their carer, because they're often looking after them 24/7, and just a respite for a few hours is absolutely vital for their own mental health and well-being. Thank you.
Thank you very much. I'm going to take Councillor Carl-Brown next, if I may, and then I'll take Councillor Dedman.
Thank you very much, Chair. I'm pleased to hear from Kevin that it isn't a binary choice, as you made clear at the More Down Plus drop-in that I attended. But I am still concerned that people who weren't at one of those information sessions will have perhaps filled out this questionnaire believing it to be a binary choice, because that's how it was presented. And so, you get the answer to the questions that you've asked, rather than the perhaps differentiated or differently nuanced answer if you had presented it differently. So that still remains a concern about how that was presented. In terms of the overall, I think the thing that really jumps out at me is the fact that this is going to come essentially after the budget. So, I mean, and you said yourself this evening that this is a cost-driven exercise. That's not strategy. That's just cutting costs. They're different things, in my view. And I think in terms of service users, So I'm struggling to see how the strategy really can it can't trump the budget. And we need to be very mindful of that, because it risks being seen purely as a cost-cutting exercise. I suppose it is just a cost-cutting exercise. But what that leaves us with, and as my colleague said earlier, we are always going to need buildings in some form. One of the bits of feedback I picked up at Moordown was one of the ladies there, who was a carer for somebody who uses the centre, said, look, my sister goes on the community trips that are organised from Moordown. So she does the community side of things, but she's not actually going to do that if it doesn't start at the community centre. Because if she gets on a bus in any other shape or form, she's not going to get on the bus unless it starts from the community centre, because she won't associate it with that safe place, which is that building and the people there and the service that she has become accustomed to and is a lifeblood for her and for her carer, her sister. So I think we're at the risk of almost differentiating, doing a hard, line between community and building, whereas actually it's not that hard a line for a lot of people. So I suppose what my plea to you, it's more a plea than a question, is that can this please be a long-term and joined up decision from BCP, and not just cutting something now because yes, we're up against it, something that we actually need, and also joined up in as much as, for example, Moordown Plus is currently underutilised, and I know that there are other community groups that would like to use it, and to my knowledge, they haven't been spoken to. So where's the strategic approach from that? That's the sort of thing I mean about being strategic, genuinely non-silo strategic about this, please.
Are you able to respond to that, please?
Yes, certainly. Thanks, Councillor Carl-Brown, and thanks for your attendance and input at our Moordown engagement as well. The draft strategy very much looks at the future provision of day opportunities, and from all of the data and the input that we've had from people as well, particularly in the questionnaire that went out in 2022, was looking at that mixed model of day opportunity provision. And within that questionnaire, we had approximately about 55% people who really place value in a day service building, and 45% of people who were less fussed about that, but also or would actively say, "I know I would not want to be in a day service building." When we reflected that against the budget that we currently have as well, 90% of our budget was in day service buildings and only 10% within the community provision. And therefore, really what the draft strategy suggests is that there is a balancing of that as well, but that would require monies coming out of where we currently have it in day service buildings and being reinvested into a community provision. The strategy is very clear about the fact that we do need day service buildings, and that people require those, particularly if their needs cannot be met in the community. And many people who access current day service buildings would fall into that category. Others wouldn't, and it may be about choice of services for them to consider accessing as well. And ultimately, the strategy is about creating greater choice for people to have a range of services to access, dependent on their needs and wishes. But currently, that is not reflected in how our budget is divided between those two services. I take the point about there being that blended approach as well, in the sense that the draft strategy also says about having making sure that building-based services are community hubs and are therefore open to other community groups to come in. We haven't directly engaged with people about that because services decisions have not been made in regards to those services, but and indeed the draft strategy has not been approved yet. But that is certainly something we would wish to happen for our existing day service building provision, is that they are community hubs and that they are inviting potentially other groups to use those facilities and therefore maximise the use of our day service buildings.
Okay, what I'd like to do then is to take question from Councillor Deadman and then come back to the recommendation from Councillor Rampton, please.
Thank you, Chairman. I've got a couple of real questions, but may I just say initially that as the original Adult Social Care and Health Cabinet member, when this council was formed, I'm surprised to be hearing that it is a cost-cutting exercise, because day centres have always been under discussion, as far as I know, for many years. May I declare another interest, but an old one that's gone now. I was a nursing home owner for many years, and we all know that day centres are thought of as being a place where you park your granny while you go to the shops. So I feel that to be pushing this line that, oh, well, it's cost cutting, it isn't. It's a reorganisation, as far as I remember from my days there, of what we provide as a council, and also what we allow the community to provide. And as you're saying, I think you're calling it nowadays micro providers, which is new since my day, but there we go. So one question that I have on the micro providers is that you mentioned that you are going to provide a standard of how they operate. And it's not so much a question, because I'm sure we have to do that, but I do hope that that won't be the sort of thing where, instead of actually looking after the people that are with them, they're filling in endless forms to say how they've looked after the people. Because I know from bitter experience with volunteers and with staff that that is the death of those types of voluntary services. If you've got to fill in forms, then you think, right, I can't do it. So I would really like to be reassured that that isn't going to be some draconian imposition. The other point I want to make is that you've got some figures here, which naturally I've lost on this machine. So Highcliffe Plus, you've put down day service attendance for 2023, Highcliffe Plus, etc. Now, I'm pretty sure that I've talked to Phil about this, but I'd like it stated, because I know people watch from outside. Highcliffe Plus older people has been shut since 2020. So you got the figures, obviously, from Christchurch Connect, where all the Highcliffe Plus people have been shipped off to. So that's that question. And the last thing, which is more of a statement, sorry to go on, Chairman, breaking my 3 minutes here, aren't I? I'm sure. But the other thing is that you're talking about communities wishing to work in these buildings. There have been so many requests of, can we use the Highcliffe Day Centre building, from Highcliffe people for various things, even the doctor's surgery. And I really would like to think that we're getting forward with that. I can't see Highcliffe ever opening again as a day centre, and I really wouldn't want it to be honest, but I think that it's a valuable building. And I wouldn't also like to think that, just as Christchurch Civic Centre has cost thousands a month to keep going empty, that we're going to keep these buildings empty for another couple of years. I totally agree with Councillor Rampton. We might need to consult a bit more, but not for years and years. I don't know. I'm so sorry. I don't know if there's a question in there at all, really, but I'm sure you'll find an answer.
I can't think of a standing order appropriate, sir. Mr. Gillies, could you respond to that, please?
Thank you, Councillor Zedman. Thank you. Yes, in regards to the standards of day opportunities, that is very much something we wish to co-produce. It is an oddity, really, and I've worked in day services. I've also managed care homes in my time, and it's an oddity that day opportunities aren't. There's no governing body to ensure the standards, such as Care Quality Commission, do not go in to day opportunities. We do not have standards across for day opportunities, which particularly the co-production group were really keen to have in place, and to also ensure that those standards are met as well. We used to have, for example, citizen checkers from People First Forum going into services to check on that, and indeed they've come into my service as a registered care home, and their input as from a user point of view has been really valid. I'm very keen, having worked in those services as well, to not make it onerous on staff. I completely agree with you that they should be getting on with the job of caring and not filling out forms. But we also need to provide outcomes for people. What we do have sometimes with people who access daily opportunities, not always, but for some, is that they don't have specific goals and a purpose to what they're doing, even if that is simply engaging, providing care or respite, but actually looking at what people want to develop or how they want to be supported is important. And those can be achieved without being onerous in terms of paperwork completion as well. I would say in regards to I think you mentioned about the sites at Highcliffe Plus as well for older people. You're correct in terms of we looked at people who are currently accessing Highcliffe Plus based at Christchurch Connect. We also try to engage with those who didn't come back to that service as well to identify where they were or why they weren't accessing that service as well. And we mapped out that as well in terms of people's journeys, the actual physical journeys to that location. In our engagement work with Highcliffe Plus as well, given that they have now been at Christchurch Connect for some years, since 2021, when services reopened, it was very much the view actually they were quite settled there, and you were right, they need a decision about their service, that they are remaining there, are they going back, are they using an alternative provision, and actually that can almost stop the service developing because they require that decision to be made. In terms of the existing Highcliffe building on Lymington Road, we've engaged actually with the surgery next door to it as well, and informed our corporate property group of their interest in that facility. I'm very much aware, having run a care home near Highcliffe surgery, how small that is, indeed in terms of car parking facilities, but also for them to be able to house staff as well. And so that would be a corporate property group decision if that property was to come back into their portfolio following this consultation and any decisions by Cabinet.
Okay, well, thank you. What I'd like to do, if I may, is just to clarify the additional recommendation from Councillor Rampton, which is as follows. So this is to add paragraph C, to allow a further period of consultation, brackets 3 weeks, question mark, close brackets, to enable the People First group to engage fully with their members and bring their views back to the co-production group. Are you still happy to second that, Councillor Fell?
Yes, I'm still happy to second that. Thank you.
Anybody want?
Sorry, Chair, the in brackets 3, it's negotiable. I started a little bit higher. I'd go with 2 weeks if that made it easier for officers.
That sounds familiar. Any comments on any of that, please? Oh, Joe.
Super quick. I'd really love to know, because I think we can see the number of respondents, but we can't see the total sample size. I think that would really inform whether or not it's worth banging out more days of consultation. And also, if by chance anybody's got the rate of response over the last few days compared to the overall, because if it's just totally dropped off and nobody filled it out in the last week, and actually we've had 50% of users, what's the point?
Are you able to help with that, Mr. Gillings?
I can say that when I came back on the 2nd of January, we had just over 300 responses. As I checked on Friday, we had nearly 600 as well. So just give some context to the number of responses that have been coming in during that period.
Mr. Hornsby.
Just to respond to Councillor Salmon, there wasn't a sample size, it was an open public consultation, so all members of all residents of BCP council area could respond. So it wasn't like we only selected a certain group of say 1,000 and said come back, which would allow us to do the sample size and proportions that you talk about.
So we've got no idea how many of the service users have responded to the consultation.
Actually, we literally, the consultation closed on Friday, so they'll be collated and we'll be able to see, because we've asked the question, are you someone who uses the service, a care of someone, are you a professional, are you a stakeholder from another organisation? So we will know when we've collated all of those responses and done the analysis.
Councillor Cabral.
Sorry, for the benefit of new councillors, could you just tell us exactly who are People First?
Was that to me?
Through the
They're
chair,
a
perhaps.
self-advocacy group, and they're a merger of the original Board with People First and Pool Forum. And they're now People First, the BCP.
Okay, any other comments on the additional recommendation that Councillor Rampton has proposed? Councillor Denton.
Can you just, Chairman, give us an idea of how that would work? We're talking about more time, but do you mean more time from today, or how do we get this more time sorted? Although I am in support of what Councillor Rampton says, I just want to know the mechanics.
It's a good question. I'm looking hastily towards the colleagues. How does that fit in with the timescale, Phil?
Oh, thanks for putting me on the spot, Chair. It's part of the budget consultation in effect, and the budget setting happens in February, so I'm not quite sure how we can extend the timing now. And then the March overview and scrutiny and cabinet meeting, of course, the deadlines for papers for that will be upon us before we know it. So I'm not quite sure how we can extend unless there was some deferral of the budget setting process. I don't really know, to be fair.
I'm just thinking aloud here, so forgive me, but is there a way forward here which says, almost irrespective of that, I'm just not dismissing, but almost irrespective of that, could we ask the People First group to do that? And because we're going to come back here in March, aren't we? So there's still an opportunity for them to do this between now and our March meeting. Does that make any sense at all? We can still gather these additional views, can't we? And put them into the mix in terms of our deliberations. In addition, in addition to the formal report back which we're going to get from yourselves. Is that mad, or am I just going senile? Councillor Rampton.
Thank you, Chair. That's not a bad idea. Could I suggest perhaps that if members were inclined to support that, rather than cause any delay to the budget setting process, that the People First group could be told, yeah, carry on, and all your responses will be included. And you and I already discussed earlier that People First may wish to come along to the meeting on the 4th of March to make their views known to members as well, and that could be perhaps they consolidated at that meeting.
It's probably an unknown, probably not a question you can answer, but how quickly do you think they would be able to do that? It's a daft question. I shouldn't have asked it, really, should I? Mr. Gillings, in terms of the paper, which you are part of the team are going to produce in readiness for cabinet, I guess I'm asking what would be the latest point at which any views from the People First group and their members be able to feed back into that? Does that make sense?
Yes, I do have some concerns about the proposal in terms of the timings and producing papers for March. Overview and scrutiny and cabinet is quite a tight turnaround of information. We have an outside research company which are busy collating all of the information we received. We've also received a lot of representations through councillors, through MPs, and directly to ourselves, which are being included in the consultation outside of the questionnaire responses. And pulling all of that together, I have spoken to the research company this morning. They are looking, given how many the level of response we've had, which is really significant, of being able to provide a report on the they're hoping on the 1st of February. But in order for the processes to get to overview and scrutiny and to cabinet, we did consider an extension as requested previously, and if we were to stick to the March timetable, I think that would throw that out if we were extending the consultation period, because the research company would not have the time to collate all of that additional information and provide a report in a timely manner.
Again, I guess it calls for me to ask the daft question. So, and looking in the direction of Councillor Brown, how critical is it for this to get to Cabinet in March? You know, could it be the next Cabinet meeting, for example?
Put me on the spot again. Any delay, there's a cost to every delay and every month that sort of things aren't moved on and implemented. And I think it actually even stretches out for clients and carers to actually know what future provision is going to be. You know, if you push it back to April or May, you know, and there's a lot, you're extending the uncertainty and the worry, and people potentially starting to look for alternative arrangements themselves if it's not clear. And at all the drop-in sessions, you know, we've made it clear that that's what we're aiming for, is the cabinet meeting in March, coming to health overview and scrutiny before that, and that's where we're aiming. You know, people wanted at the drop-in sessions wanted to know, well, is it stopping or is it starting? You know, their loved one needed to know, they were already getting concerned. So I think the longer you delay it, the more anxiety and concern that will result in. You know, it's a tight turnaround at the moment anyway, and I think it is important that we do aim for that March cabinet meeting.
Okay, so I'm just wondering whether the way through this then it is, rather than require a period of further consultation, which I think could mess up that whole timetable really from what you just described, but to still provide the People First group with an opportunity to make their representations, and somehow we'll find a way of feeding that into the system. So rather than an additional recommendation that requires a further period of consultation, what we're asking then is if the People First group will be kind enough to do this work as quickly as they are able, and to feed it into the process, and so that we can, you know, hear their feedback at our March overview and scrutiny meeting. Does that sound?
Chair, could they be informed of the absolute cut-off date as to when their representations would still be accepted and be in the formal report?
I probably need to liaise with Mr. Gillings and Mr. Hornsby about the absolute final date.
We, sorry.
Thanks, Kevin. Sorry. I think we'll have to take. I think we'll have to take away from tonight. I don't think we can give an absolute answer today, because we'll have to look at the timelines and the deadlines for the reports. So it's difficult to give a. I don't want to say a date tonight, but then I have to change tomorrow.
No, that's fair enough. So I think what we can probably do is to advise them to try and do it as quickly as they are able, and that's probably about the best we can do. But bearing in mind that, you know, there is the meeting on the 4th of March. Sorry, Phil.
No, my apologies, Chair. We can communicate directly back to People First Forum through Kevin, and once we've had a chance to look at those dates and say what the absolute cut-off point is.
That would be great. Is that
we'll
okay,
let you know as well, Chair, so that you've got that information.
Yeah, thank you very much.
Yes, I'm sure that yourself and Kevin will go back to the People First, and you will allow them some leeway. And of course, the point is that these two really huge issues in terms of closures were not discussed with the co-production group. Now, I understand they will be next week, but that probably doesn't still give enough time for them to speak with their members. So the more time, the earlier you can go back to them and give them a date, and the more time you can give them, and if we can hear from them, I'm saying we, I'm not on this committee, but if we can hear from them on the 4th of March as well, I think perhaps that's a compromise that we would be willing to accept. Thank you.
So, are you, City, pushing me? Are you withdrawing your additional recommendation?
Reluctantly, thank you.
Thank you, though. Councillor Brown.
Just a very brief addition to that conversation, and also to the point that Councillor Salmon brought up about the number of responses and the sort of population. And as was said, obviously, it was an open consultation to any residents, or could be clients, could be carers, could be staff, could be anybody, past users. Just to say, if we're looking at approximately 600 responses so far, there are currently approximately 475 clients who access Tricuro Day services. So just to put that in context, that we've had around 600 responses to the consultation, and that could be clients and their carers or the family members. But I think that shows the level of response, the level of awareness of the consultation. It's not one of these consultations where people just haven't been aware of it until the 11th hour.
Okay, thank you, everybody. Can I just close this off then by asking you to agree the recommendation as per the papers? Is everybody content with that? And we will obviously follow up. Oh, somebody will follow up with the People First group. Thank you very much indeed. And thank you, Mr. Gillings, for your time.
Thank you, Chair.
Right, we move on to item 7, which is the BCP Carers Strategy. And I'm going to invite Emma Senior. I'm going to get a proper title: Strategic Commissioning Manager for Prevention and Wellbeing. We have read the strategy, so just give us the main headlines will be really great, and then we'll take some questions. So thank you very much indeed.
Thank you. I'm going to ask Tim Branson if he could share a brief presentation that we've prepared. Thanks, Tim. So I'm Emma Senior. I'm the Strategic Commissioning Manager for Prevention and Wellbeing. I commission our carers services, and I also work closely with Tim Branson, who's our Head of Access and Carers Services. So you've all had sight of the committee report and the implementation plan for the carer strategy. So this is a really brief presentation just to give a high-level overview. If we could go to the next slide, please. Thank you. So just wanted to start by providing a definition of a carer. So a carer is anyone who looks after a family member, partner, or friend who needs help because of their illness, frailty, disability, a mental health problem, or an addiction, and cannot cope without their support. The care they give is unpaid, but this does include people in receipt of carers allowance. So just some local context, we've got over 35,000 people in Bournemouth, Christchurch and Poole that are carers. That's according to latest census figures. And 6,800 carers are known to BCP's Carer Support Service CRISP, so about 19%. And nationally, there are thought to be 5 million carers in England and Wales, and they contribute a staggering £445 million to the economy every day, which is £162 billion a year. So the BCP Carer Strategy was approved by Cabinet in September 2022, and it sets out 5 key priorities to support carers and recognise the valuable contribution that they make to our community. The 5 key strategic priorities are identification, recognition and involvement, information and advice, supporting carers' physical, mental and emotional well-being, a life alongside caring, and collaborative working across Dorset. So here are some updates from the last year. The carers team relocated from St Ambrose Cottage in Westbourne to Boscombe Resource Centre in early 2023. They're now co-located with another adult social care team, and they're in a more central location. We recommissioned the Dorset Carers Card in early 2023. That was a joint venture with Dorset Council to ensure that carers have equity of service across the county. And the new supplier, Forward Carers, provides added value with the introduction of photo ID, which is something carers told us they wanted. And they also create carer-friendly communities by encouraging businesses to become carer-friendly. We also recommissioned the Carers Advocacy Service with Swan Advocacy and the Representation Service for carers of people with a learning disability with Minstead Trust, helping to ensure that carers are able to express themselves clearly and raise issues or concerns where necessary. We continue to play a substantive role in the Pan Dorset Carers Steering Group, co-producing the new Pan Dorset Carers Strategic Vision and ensuring that it is aligned with the BCP Carers Strategy. So looking at our future plans, we want to rebrand CRISP to BCP Carers Support, and we are now intending to launch that rebrand in Carers Week, which is in June 2024. This will provide a larger audience with a number of carers events planned during that week. We are also hopeful that the carers team will have increased staffing levels by then to be able to cope with the additional command that the rebrand will create. We've also just submitted an expression of interest for the Accelerating Reform Fund, which was launched by the Department of Health and Social Care. The fund is available to kickstart the development of projects which deliver on priorities aligned to their 10-year vision for social care. Two of the projects we are bidding on are focused on carers. The first is to expand shared lives to include carer respite, and the second is to focus on carers' experience of hospital discharge. We are also looking to launch a BCP Staff Carers Networking Group in 2024. We have the support of the Corporate Director for Wellbeing, Julian Kay, who is going to host an initial meeting to gauge interest. We are also working with the Young Carers team to improve the information and support available to young carers when they reach 18 and when responsibility changes from children's to adult services. We are also looking to increase the staffing levels of the carer support team to enable them to deliver key elements of the strategy and cope with the expected increase in demand. One way of doing this is by using the slippage from the Better Care Fund. In the report, we said we were going to use these funds to replace an existing holiday lodge for carers. This was because the money originally had to be spent this financial year. However, it's now been agreed that the funds can be carried forward, and this will allow us to focus on more urgent priorities within the strategy. We will still be using the funds for our rebrand launch and for the Carers UK Employers for Carers scheme. That's the end of the presentation, so we're now open to any questions.
Thank you very much. I know Councillor Salmon has a few. Do you want to kick us off, Joe?
Oh God, yeah, I'm not as well prepared as I should be. Where's my email? I don't know if you did see my email with questions on the carers strategy already. So I think it was the annual carers survey. So I had a lot of questions about that, given that a lot of the KPIs seem to be based on that. So I'd like to know if we've got all of the demographic information and so forth to know if we've got a representative sample there. I'd like to know if we can scale the kind of insights from that data set. So can we compare BCP annual carers survey to the Dorset Council's annual carers survey and so on? And then I'd like to know, one thing I expect to see a lot of times in a strategy document is that 80-20 rule, you know, like 20% of footballers score 80% of the goals for their team, 20% of criminals do 80% of crimes. My assumption is that 20% of carers will be eating up 80% of the resource. I wasn't sure if that was true, and I didn't think I could tell that from looking at this document, so I just wondered about that. And then what's there? Oh yeah, trends. Love to see trends. I can see trends in the document, and I wondered if they were in evidence anywhere.
Are you able to help with that, please?
Chair,
Tim,
if I
do you
may,
want
I can probably answer the majority of those questions, I think, for Councillor Salmon. So broadly speaking, performance measures fall into two categories. So we've got those that measure process or outputs, and then those that consider outcomes. So for the former, the Adult Social Care Outcomes Framework, which we abbreviate to ASCOF, is the principal set of nationally reported data, and that's usually reported to overview and scrutiny whenever there's a broader adult social care performance report, which is presented for scrutiny. And then for carers, that focuses on the number of carers receiving self-directed support and the number of carers in receipt of a direct payment. And then the ASCOF survey, which is slightly separate, is a survey that's conducted on a national basis every 2 years, and that focuses on self-reported outcome measures. So that will be, I mean, there's quite a range of things, but it includes things like carers reported quality of life, the proportion of people who use services and their carers who report that they've got as much social contact as they would like, and things like the proportion of carers who report that they've been included or consulted in discussions about the care of the person that they care for. So although we've got about 6,800 carers registered with our Carers Information Service at the last count, which was a couple of weeks ago, the performance measures usually focus on those carers who've actually had a formal carers assessment and the outcomes that flow from that. So the number, I think in your email, you mentioned a number around about 2,800, which is the number of people who will have had a carers assessment. So not all carers that are registered with our information service necessarily elect to have an assessment, and they may have one later on, but they might not always have one at the point when they first register. So the ASCOS survey, that is a sample that goes out to a random sample of 1,000 carers out of those 2,800. And I think the last survey was the 2022 survey, and there's another survey that's just closed just before Christmas, so we'll get the results of that around about May, June time. But the last survey, I think we had a response rate of 39.6%, so 396 carers. We do have quite a lot of demographic data one way or another. We've got census data, we've got survey data. So we've got a reasonably good understanding of sort of age, gender, disability type in terms of the person that they're supporting. So we've got quite a lot of information there. I mean, we're always keen to make sure that we're covering as many groups and hearing the voices of as many groups of carers as possible. So we're always on the lookout for any pockets of sort of feedback that we may not be tapping into currently. And then I think you asked the question about comparable data. So we have run, let me just think, the last ASCOF survey was 2022. The year before, it would have actually been then, but because of COVID, Department of Health decided not to run the survey. So for the first time, we ran our own local survey. And because that was just a local survey, we don't have comparable data. But for the national ASCOF carer survey, that does provide us with comparable data, which we tend to report in terms of our performance, our nearest neighbours council performance, and then we also have a regional Southwest and a national All England set of data. So we are able to sort of compare ourselves with those. In relation to your 80-20 rule, it is quite difficult to generalize actually, because the demand will vary according to individual circumstances of the carer and their resilience to the demands that are placed on them. And it also very much depends on the nature of the needs of the person that they are caring for. So the age of the carer and their own state of physical and mental health are some of the relevant factors there. More recently, of course, COVID and things like the cost of living crisis have also become additional factors impacting on carers. But in terms of that 80-20, it's very difficult to kind of apply that rule in these sort of circumstances, I'm afraid. And then in terms of trend data, so as I said before, we've got the ASCOF data, which, as I said, we've got some comparables. When we report that, we tend to report each survey and then just reflect back on the previous survey so that we can just sort of see the difference from one survey to the next. I'm sure we've probably got the data, just bearing in mind that this will only be the second ASCOF survey that's just completed or just closed at the end of last year. So in terms of if we were looking to get some trends over, say, a 5 or 6 year period, some of that will actually then span back to legacy councils. So there may be some slight anomalies there, but it would potentially give us a rough guide, I guess. I hope that helps to answer those questions for you.
Yeah, pretty much bang on. Can I see the ASCOF survey data? Is that something that sits on a public portal, or is that something we can get hold of somehow?
There's a link. We can send you that. I think we've got a report. Probably came to Scrutiny before actually at some point, so we can definitely bring that back for you.
Yeah, if you could let us have that would be really helpful. Thank you very much.
No problem at all.
Any other questions on this, please? Councillor Matthews.
It's not so much a question, Chair, but it's just a comment. I'm actually really pleased to see the rebranding, because I think making it very explicit that, because one of the things for carers trying to demystify acronyms and so on can be quite complex. So yeah, I absolutely welcome that. But thank you.
Thank you very much. Okay. Anything else? Okay. Well, oh, sorry, Councillor Rampton. I don't know how I missed you, but I missed you.
Thank you, Chair. This item, thank you. It's a really good report, and thank you very much. Another commitment from the team who work with carers. It's a little bit ironic considering the last item, though, isn't it? Talking about carers taking a break and having time to themselves. So we need to ensure that can still happen. And I'm just going to take issue with the kind of statement that the Boscombe Resource Centre is a more central location. Well, not if you live in Hamworth or Broadstone or somewhere, it isn't. So I can't see anything in the report which says that there's any sort of service that more pool-based carers can access, but I would like to think that there would be something available to them, because Boscombe is not exactly easy for people to get to. Thank you.
I can respond to that, Chair, if you'd like me to.
Yes, please.
So we have got plans acknowledging that the move from Westbourne to Boscombe, it improves the access for some people and maybe not so much for others. So we are planning to have carers sessions in the Poole Library Hub and the Christchurch Library Hub as a way of facilitating more local access, because again, we're conscious that carers can't always spare the time from their caring responsibilities for lengthy travel to get to somewhere. So that's always been part of our plan and is built into the strategy.
Thank you very much for that. I'm ignoring being prompted to say anything about Boscombe because it's my ward. Any other questions? Councillor Devon.
Well, it's about, Chairman, it's about the rebranding. This report is wonderful, but nowhere does it give to the uninitiated the fact that we're talking about voluntary and carers in the community, not care workers. And if you're rebranding, I can't think of a word, but then that's your job, isn't it? But, to sort of say that for example, I've got a great friend of 86 who's looking after her partner of 82. And she wouldn't like to think she's a carer. She's just her. It just is a word, and there must be another word, which I'm sure you can think of.
Yeah, well, answers, all suggestions will be gratefully received, I think. Thanks, Carl Brown.
Yeah, probably just quickly, just looking at the RAG rating in the development plan. Is that what it's called? Sorry, I'm just getting back to the top of it.
Implementation plan.
Implementation, thank you. Yes, I just wondered what if what was happening with the reds, the 2 reds. What were the plans there, please?
I think I can only see one red. But Emma, that was really about the reviewing options for short breaks and respite.
Yeah, short breaks and
Yes.
respite, and then just below you've got bring support to carers in their own communities.
With
So-
short
Sorry, Emma, you go.
with the short breaks and respites, what we wanted to do is introduce direct payments so that we could provide more options for carers. Because at the moment we have a sitting service which is linked to our framework of home care providers, and there's been quite a lack of capacity in that recently. So carers haven't been able to get all of the support that they've needed. So we were hoping that by introducing direct payments, they'd be able to go to various different organisations, not just home care providers, but other organisations as well, and they'd have much more choice. But we've just hit a legal issue there which we're just looking into at the moment. That's to do with direct payments to provide carer respite and whether or not the cared for person needs to be financially assessed. So that's just something that we're looking into, and that's why we were red in that area, because we had plans in place, but we'd hit a bit of a wall there. So we're just seeking further advice on that and looking at how we progress.
So there's nothing more to say on that at the moment. You haven't found a way around it, as it were. And
I can probably come in there, Councillor, if I may. So it's something that in fact, I was discussing with other colleagues only last week. We think we may have found a way forward on that. Yeah, probably best for me not to say too much because we do just need to check it out with our legal services colleagues. But we're hopeful that we have found a solution. The issue is principally around the fact that some support that carers get is actually delivered to the person they care for, compared to other services that we provide that are actually delivered to the carer themselves. And it's that distinction is what we're just having to clarify with legal services colleagues at the moment. And in terms of the other red that you mentioned around improving access in the community, that was basically the point I was making earlier about having the library hubs available so that people can actually access support more local to them.
Betty, would you like to add something?
Yes, please, Chair. It was just picking up on Councillor Rampton's point, and Tim's just alluded to it again just now. We're really keen to make sure that all carers have access to us and what they need 3 out the 3 times. So, it isn't just in the Boscombe area, having relocated from the carer centre last year. We're really keen to have hubs in the 3 areas that are really convenient for people, the closest one to where they live. And Tim and Emma, with all of the practitioners and everybody else within adult care right across commissioning and operations with our NHS colleagues, really focused on carers and giving carers as much support. But there are fundamentals that we need to work within, which is some of what Tim and Emma have covered around. Is the support given to the individual who has the care needs, or is it given to the actual person who's the carer? Because both fall under the remit of carers service provisions. For example, if a cared for person actually has respite out of the family home, then that is given to the cared for person, but it is for respite for the actual carer. So it's all of those kind of things that we need to take into account. But we're working with carers. Tim meets with carers. We have carers groups and carers forums to really hear their views, because without our carers, our unpaid carers, we would not be able to support the people in the way that we're able to do that. And, we really understand that and value that. Thank you, Chair.
Thank you very much indeed. Any final points? If not, I'd quite like to move on, if that's okay. But thank you very much, Emma, and thank you, Mr. Branson, for your help with this. Thank you, Betty. We're going to move on. Good piece of work. Thank you.
Yeah.
Right, item 8. health inequalities. It's background briefing from Sam Crow, please.
Thank you very much, Chair. Good evening, committee. So I'm Sam Crow, Director of Public Health for Dorset and BCP councils, and I'd agreed to prepare a background briefing on health inequalities, which is really just it's a taster course. It's a large area, it's complex, and the report's been structured in a way which I hope brings the committee up to date with what the challenge is around health inequalities, the statutory obligations of the main organisations in our integrated care system, and a bit of a read across where some of the current work is taking place. But the real purpose of the report isn't to sort of get into the data as much as to support the committee with what you might want to look at in terms of developing your work programme. So I'm going to make a few key points, but I'm not going to go through the paper in a huge amount of detail because I hope you've had a chance to scan it. And then I'd hope that we could have a helpful discussion and open up for questions and perhaps formulate some areas where the committee might want to dig a little bit deeper on its forward work programme. So that's the kind of purpose of the presentation tonight. So just a few things to say, really. Health inequalities are not the same as variations in health. So they have a specific definition within the context of this paper, which is that we're really looking at situations where there are avoidable variations in health outcome. There are avoidable experiences, there's avoidable differences in access when people are coming forward for care and support. Obviously, anyone with an understanding of biology realises that there are variations that naturally exist in the proportions of people that are at risk of different conditions. But where you have circumstances of unequal access to pathways, late diagnosis, differences in education and income, social circumstances that combine, then in almost every area in England, you can see observable patterns of variation, either in mortality, so the rates of death for different conditions, or the amount of time that parts of the population spend living with either a long-term condition or a disease or an illness that causes them significant impairment or disability. And that's really what we're talking about in this paper. The two main public health measures that we've looked at for many years to try to assess the degree of the variation across areas like BCP Council are things like life expectancy, which will vary across the wards of BCP Council from between 5 and 10 years, depending on whether you're looking at males or females. It changes every 2 or 3 years, but it's largely remained within that kind of bracket, if you like. The second measure, which I talk about in this paper, is healthy life expectancy. And I think that's a more important measure, to be honest, because that's the amount of time that you can expect to live with a significant disease or disability, which will have significant impact on your life. And if you look at the data across the council, there's a variation of up to 19 years when you look at ward level in the amount of time that you can expect to live with, free from significant health and disability. One of the challenges is that if you take a public health approach to starting to look at patterns of inequality, I don't think that it tells us very much about the reasons why people have ended up with this variation. So I'll give one example that's often quoted. When you look at the life expectancy, for example, in Boscombe West, often that's highlighted as an area which has the lowest life expectancy, but I can promise you that it's nothing to do with intrinsic conditions in Boscombe. It's largely to do with the fact that it's one of the cheapest places in Dorset where you can get a housing unit. Who's that likely to attract? It's likely to attract lots of people who are already struggling with health issues. So what you're seeing is a pattern which is arisen because of the complexity of access to housing. So it's far more simple than just saying you can look at a public health measure in a particular area and assign causality to why that's come about. Does that make sense? So we've got very, very good public health data which will show you where some of those inequalities exist, but it's less good at explaining why they've arisen and more importantly, what we might be able to do about it as an integrated care system. So in the paper, what I've tried to set out is a very simple framework for getting us to start to think, where do statutory organisations have a reasonable degree of control over some of the treatment pathways, access to care and support, where it's possible that we can start to think how to make adjustments to make sure that we can improve access, improve engagement, and improve support, probably by giving some groups a little bit more targeted support to make sure that they have the best possible chance of having a good outcome from coming forward for that care and support. And what I mean by that is that in the public sector, it's unrealistic to look at tackling health inequalities as a programme that should be supported by a separate budget. I don't believe that that's what this is about. What this is about is challenging all organisations that provide care and support to really understand who needs the most support to engage with that treatment pathway or that intervention to get the maximum benefit, so that we don't see some of these gaps appearing that we see in our current data. So this is about business as usual. It's about challenging providers to think differently. And the way that I sometimes think about this is that if you look at all of the people who come forward for something like a blood pressure check, for example, primary care knows lots about the people that do come forward for those types of risk assessments, but they know very little about who doesn't come forward, simply because they're not seen in the surgery. So this is about thinking who's not coming forward for some of these important interventions, and how can we change our thinking and perhaps provide them differently to make sure that we can increase the number of people who are engaged and increase the chances of everyone having as equitable outcome as possible. When you think from the perspective of BCP Council also has a statutory duty to identify health inequalities and to do its best to tackle them. Then instead of thinking of things like access to treatment pathways, the council has a huge potential to maximise its impact through what we might call civic interventions. So if you think of housing policy, if you think of access to housing, if you think of all of the potential opportunities to offer children and their families the best possible start in life, there's huge scope to make sure that people get off on the right foot. And I've alluded in the paper to a really important paper by Sir Michael Marmot, which identified 6 policy objectives. Several of those are a good fit for the sort of scope of operations of a council. We're thinking about maximising the opportunities and the chances for young people. We're thinking about maximising opportunities for people to go into a decent job, have a decent quality of life, but also thinking about the importance of social networks and whether people have good support either from their family or friends. So the paper's not written from the perspective of providing solutions, but it's intended to try to stimulate interest in the committee in trying to identify some areas of work which may be coming forward as we start to develop as an integrated care system, and to frame some questions where committee might want to start to say, could we request some more information to start to assess whether we're making progress? And just draw your attention to towards the end of the paper, section 3 sort of highlights some of those upcoming areas which might prove fruitful for scrutiny. So it's not intended to be prescriptive, it was more of a starter to the conversation. If we're looking at service-based work, I think the really important task is for us to try to identify whether we can reduce the current variation. I mentioned hypertension before. If you look at the variation in the proportion of people who have their blood pressure controlled, it's huge across not just BCP Council, but Dorset Council as well. Some practices achieve control in around about 30% of people with hypertension. Other practices are achieving 70 to 80% of people with hypertension. So the question is, why does that variation exist? who's getting a raw deal, and more importantly, what is the integrated care system doing to try to iron out some of those variations. In terms of public health measures, even things like vaccination programs show variation. So not just things like COVID-19 vaccination, but important childhood immunisations. At the moment, UK Health Security Agency is quite concerned about measles cases. We don't have cases locally, but there have been outbreaks in Birmingham and London. If you look at the variation in the coverage at age 5, you'll see that while we do well on the whole as a council, and our immunisation coverage rates are very, very close to those of England, you will find variation when you look at ward to ward. So making sure we understand why that's happening, and importantly, what's going on the ground to make sure that we're maximising our attempts to reduce that variation is really important. In 3.7, there may be an opportunity as we start to refresh the Health and Wellbeing Board strategy, and we start to look at some of the place-based working to identify some issues that we're interested in, that we think are important, that will make an improvement in population health, and to put a marker in there to perhaps follow up on whether we're making a difference. So the question is, are there sufficiently clear and measurable actions for partners that we could track? And then 3.8, I think it's also important to look at some of the change in thinking that's going on around work that's being led by the community. I've been involved with the Poverty Truth Commission in BCP Council over the past year, and I think some of the conversations that are happening around power are really interesting in this space. So inequality can have an impact on health, not just because of inequalities in gender, but other power imbalances, whether it's racism or other disadvantages. So if we ask questions of the contribution that the community and voluntary sector could make, how are organisations like Community Action Network engaged in this debate, and are they able to offer a meaningful contribution to some of those new opportunities, such as the wellbeing hubs? So don't intend to say too much more, Chair, but I'm happy to kind of open up for questions if that's a helpful intro to the paper.
Thank you. A couple of hands already. Thank you very much indeed for the paper. I had that awful question in my mind when I read it. Oh goodness, I hope it wasn't me that asked for it, because it is so much in it. But I would be keen for us to try and explore 3.7 if we can. I'll take other contributions, obviously, but I just have this hang up, I guess, about the way in which all of this stuff works, local government health, that to some extent there is a little bit of silo working, and the more we can do, to break down those barriers by integrated care seems to me to be absolutely essential. So the other thing I like about 3.7 is the thing that we flagged up in this committee before, to try and get a closer link with what the Health and Wellbeing Board are doing. I'm not saying I'm going to copy what they're doing, but a better understanding of the direction of the Health and Wellbeing Board. I think that would help us. So I think 3.7 would enable us to do that. But that's my my sixpenneth. Councillor Dedman.
Yes, thank you. That was a really interesting presentation. Thanks. Do I call you Mr. Crow now instead of Sam? Thank you. One thing I would say, being so old, is that back in the day, the nanny state was vilified and now it's applauded. But there you go. That's just a personal view from the 70s. All in this paper, there is one comment about education providers. But to me, the whole thing is very much peer pressure. You're talking about vaccination. If your next door neighbour says, "Oh, not putting my child through it," they don't either. And while you're saying, I think you've actually said that Boscombe West, which we all know and love, I actually moved down to Boscombe West originally. Yeah, it's good there, apart from the needles. Sorry, scrub that. No, I really can't accept the simplicity of housing, low price housing attracts poor people. Access to housing is a factor, and you're kind of equating things. And it, to me, the whole situation is really, really simplistic when you put it out like that. It's nothing to do with, well, I'm not going to get on the soapbox, and it isn't a question, but if we take this on as a scrutiny, can we have far more of the depth of where these reports come from and to? I mean, this thing about one of the aims is to prevent 55,000 children from becoming overweight in 2040. Well, how do we know that they were never going to become overweight? It's those things I think we really need to scrutinise. I'm sure Councillor Salmon would help me with that data. Yeah, but it's that sort of thing. How will we know that we're succeeding? Not that I'll be here in 2040 with any luck, but it's that sort of thing, Sam, that if we are chairman to go into this, we really need to go into it deeply and not just say, oh, well, it's poor people or peer pressure. Thank you.
I'll take Councillor Salmon at this point, but I know Councillor Calbrown's waiting, so I'll take her next. Joe.
So yeah, rather kind of opportunely, I did have a question on the obesity data actually, and your colleague Natasha, I was really impressed with her response because she gave me a lovely data set, but I was a bit curious because it did say, from my reading of it, is there are 450 children every year in year 10/11 who we go are obese, and if there are only 450 a year, if we reduce that to 0 tomorrow, I'm not sure we'd hit 55,000, but I'm crap at maths, you know. But I know it's not the right time to drill into the data to that detail. But each one of those points, actually, I think they are worthy goals. I'd love to know what they're specifically being tied to in terms of what the actual KPIs are. What data are we going to be scooping up? And I know they're new targets, but it sounds like there probably are historical data sets that we'll continue to utilise. On the blood pressure thing, it made me think of the best presentation I ever saw by the DICE, and it was on a surgery in Weymouth, and they had identified certain patients who weren't getting the right asthma medication, and they were able to go, oh, we can identify from, look, actually all of these patients, you know, they all needed new medication. These were things they've got in common. We've done a proper like two-tailed test of statistical significance, got more patients in, check them. They need more asthma medication. We now have an innovation that scales, you know, so we can go to any GP surgery, right? Any of your patients fit this profile, bish, bang, bong, you know, get them in to do their asthma medication. And I think the thing that stops innovations was being scalable is the health inequalities. You know, what works in Boscombe with all the needles might not necessarily work in Sandbanks, you know, and vice versa. So it would be really nice to know those clear kind of objective measures of success. And then was there something else? No, it was it. Your colleague Natasha was absolutely bang on when she came back to me. I just want that for every point in the thing.
If I take Councillor Calbrown and then I'll come back to you if I may, so.
Thank you, Chair. So I suppose, yes, I understand why we have lots of numbers. I get nervous when I see lots of numbers because I always think of process targets rather than outcome. It always feels like we're measuring just the process rather than the outcome, if you see what I mean. And of course, I think what you were saying at the end is that you want to actually get much more focus onto the outcome, very meaningful, almost like qualitative as opposed to quantitative outcome, although everything has to be quantified to some degree. I do understand that. So it seems to me that in terms of what we can do here, we do need some kind of like symbiosis with the Health and Wellbeing Board. I don't know where their strategy process is, their setting process is exactly. But the thing on the wider scale that I wanted to ask about is where it alludes to what Councillor Canavan was saying right at the beginning is, do we have at this moment in time, or where are we going with the idea of pooled budgets with NHS Dorset? You know, what are the drivers? What are we doing in that sphere to really drive bringing health and what we do in prevention, in public health? How are we really bringing that together? Because I'm not aware of it yet.
Can you help with any of that, Sam?
Thank you. I'll give it a go. Some quite challenging questions there, but I'll do my best to pick them up. I think coming back to your point, Councillor Dedman, it's not to oversimplify the issue, but I have described it before as looking down the wrong end of the telescope. So when you see an association between a poor outcome and a geographical area, it's quite tempting just to say there's something intrinsic about that area. And of course, it's not just about housing, but Boscombe is the lowest market value for housing units, and people who can't work, people who have addictions and people who have long-standing mental health issues will tend to live there. They're more likely to live there because that's the cheapest place in Dorset to get a unit. So by the time you come to looking at some of the measures of health that get picked up and feed into things like deprivation scores, you tend to see that there's a lower life expectancy in that area. But of course, it's more complicated than that. That's just one measure. In terms of vaccination and sort of comments about free will and nanny state, again, it's a good challenge because one of the challenges around health inequalities is that information doesn't always go in the same way to different groups. So understanding why people aren't coming forward for vaccination is really important. We have this in COVID-19. There's an assumption that it's just about a lack of information, but actually if you dig deeper, a lot of the time it's a lack of trust. So these issues around power are really important. And you can't reduce it to a simplistic argument. On the issue of the ICB joint forward plan and the target around obesity, obviously that's another plan. That's something that NHS Dorset have put out there to say we feel we need a visible outcome. If you took a health inequalities angle around that target, as committee, you might want to say we like that target, but can you tell us more about the progress in some of the more deprived areas? Because if you look at the public health data all the way across England, you'll see a gradient, and the more deprived the area that you live in, the higher likelihood it is that you'll see a greater proportion of children who are overweight or obese. That gradient exists almost in every area in England. So maybe getting behind some of these high level targets would be a reasonable thing for committee to ask. What is it that we are doing in some of the areas where there may be more children who are obese or overweight? And in terms of your point about the numbers, Councillor Salmon, the 450 is just the children who are obese. I think their target speaks to avoiding overweight and obesity. That's why 55,000 is a much bigger number, but I'll double check that and come back to you. I think that platforms like DICE that offer that chance to break down the information by primary care network are really important. That was the example that Councillor Salmon gave over respiratory conditions. However, it's not good enough just to have the information. And I think one of the conversations we need to get into touches on your point, Councillor Carr-Brown. Even before we get to pooled budgets between the NHS and councils, there's something about working better together and understanding that if we all had a common goal, what more can the council do? What more can communities do? What more can the NHS do to try to reduce this variation? Because one approach or one change is rarely enough. And we've talked about a lot of the reasons why that is. You can't just expect people always to turn up for risk assessments, diagnoses, the start of interventions. Sometimes you have to do that in a different way. We've had recent experience of this through the NHS Health Checks programme, which has often been provided through GP surgeries and pharmacies. It's clear that in some parts we weren't reaching people that do have cardiovascular disease risk factors. So we've worked with our health behaviour service, Live Well Dorset, to offer an outreach service where they're more likely to come to a community, advertise that they're offering health checks, and just try different ways of getting people in for a risk assessment. So I can't comment on the progress that we're making towards pooled budgets, except to say that it is an aspiration. So as place-based partnerships develop, that's very clearly something that NHS Dorset have said that they want to look at. Well, I don't think that's the whole picture. I think that there's a role here, as I've said, for council to understand what more we can do in the policy space. There's a role for NHS Dorset to make sure that we're mainstreaming and understanding of how to make sure that we're reaching some of those people that don't come forward for interventions. And there's also a role for the community. So going further and understanding, what are the barriers to taking up interventions like vaccinations, it's really important that we work with people in communities to address that.
Thank you. Could someone just help with Councillor Carr-Brown's question about where we are with the Health and Wellbeing Board strategy, just in terms of timeline?
So we had a development session in December with the Health and Wellbeing Board. It was a very productive conversation. I think that the next step will be to take a paper to the Health and Wellbeing Board, which I believe is 5th of February from memory. And that paper will set out a timeline and a process for starting to refresh that strategy. But one of the feelings of the discussions in that development session was that the strategy, while it's important, is perhaps not as important as getting detail on what are the most important programmes from that place-based partnership perspective. So think of the strategy as a framework. I think that the focus of the work needs to be getting more detail on what are the most important programmes. And that's where the question from Councillor Carr-Brown is important. What is the potential for starting to look at perhaps, increased joint commissioning approaches in line with the national direction of travel?
Yeah, I just wanted to add one other piece of the kind of strategic jigsaw, if you like, that we'll be factoring into that. Obviously, Council's adopted the new vision last week, which has healthy people in healthy places right at its heart. And the next piece of work that we'll need to do is to produce delivery plans around that vision. And obviously, we'll need to keep a really close connection between the Council's vision, a refreshed health and wellbeing strategy, and then, as Sam says, those really critical programmes to make a difference on the ground. One other point I wanted to pick up, and it just shows the connection between this item and the item we'll come on to around the data working group. I think this item has just really, really illustrated how timely that piece of work on data is. Because if the committee does want to get into tackling health inequalities, because the discussion's shown, starting with a clear set of questions, understanding and really using the data, but probing and getting underneath the surface of it and saying what's really going on, is going to be a really important and helpful piece of work, I think.
Just very quickly, and this isn't a criticism, it's just a sort of an exhalation of a little bit of exasperation that the ICB has existed for 2 years. It was in shadow form for a year before that, I think. There was an STP that was the exact same footprint prior to that. Health and wellbeing boards have existed somewhere between 8 and 10 years. I can't quite remember exactly when they were enacted from the Wonderful Health and Social Care Act. And yet we're still only talking about an aspiration to pool budgets. And I know we didn't have the key driver into pool budgets perhaps before, but it just feels like, are we really, I don't know if we're making progress. I don't know if we are.
I guess, yeah, it's a good challenge, isn't it? But I would caution against seeing pooled budgets as necessarily a solution in itself. One of the helpful things that has happened since the ICB has formed is that explicit recognition of their duty around health inequalities has led to a lot of people starting to question why is it that they do very well with some groups and do very poorly with other groups. But I think that challenge of mainstreaming it in the way that NHS and other health and care services are provided is going to take some time. But I have been encouraged by the number of people who've been involved and gone through training and starting to think differently. So some of the conversations about even thinking about work on waiting lists, understanding who's most affected by being on an elective waiting list. Are they unable to work? Do they have a mental health condition? The NHS is starting to think very, very differently to just using a straightforward clock-based measure of how long you've been waiting. But this is a big change for them. This is like turning a tanker around, isn't it? Because the NHS has always operated from the kind of time that you went on the list. You just let the clock run out. So I think changes will happen. I'm hopeful that Scrutiny could play a role in perhaps speeding up that by offering some really helpful challenge. That's what I think the committee could play a really strong role in.
So, just in terms of trying to wind this up, then, is a good place to leave it. That outside of the meeting, we will try and investigate the possibility of of doing some work around tying in with the health and wellbeing board strategy around how do we get down to the detail of that in terms of the delivery plan that Gillian's talked about, because we know from the discussion that we had at council about the corporate strategy that there's the vision statements, those documents are going to be produced. So we need just to find out, I think, about the timeline of that and how we might be able to influence that, and what work we might be able to do, which wouldn't necessarily get in the way of the Health and Wellbeing Board, but might add to what the Health and Wellbeing Board is doing. But that's going to, I think, take a bit of thinking about outside of the meeting. Does that sound a reasonable way forward? You happy with that, David? Okay. Shall we move on then? Thank you very much for that. Data working group. I'm going to hand over to Louise.
Thank you, Chair. Okay, this report was agreed at the working group, which met on the 11th of December as the scope for the future meetings of the working group. The purpose of it coming to committee tonight is for you to approve the scope. I don't think any more details are needed than that. I'm sure you've all had a chance to read the report. Thank you.
Are there any questions from anybody about that, please? Is everybody happy? Joe?
Oh, I just wanted to apologise that I couldn't make it. I read the notes. I'm really sorry. Family stuff happened. I dropped the ball, but it looks like it was a really good session.
Thank you. Wow. Everybody, are we happy to approve this then, please? We are in the process of trying to pin down a date for the next meeting, and we'll continue to do that. Right, item 10, portfolio holder update. Councillor Brown.
Thank you, Chair. I'll try and keep it to bullet points really, and I'll pick up on a couple of the sort of the last points made. Yes, it's the last meeting just to update on a few things that are going on within health and adult social care or things I've been involved in. It's actually been a really busy time, despite the sort of Christmas and New Year break. There's been an awful lot going on. Obviously, as said before about ongoing budget discussions and conversations, but the big thing that we've discussed obviously tonight is around the day opportunities consultation and drop-in sessions. I think the drop-in sessions were really useful actually, and I've been to all bar one in the last couple of weeks, and it's really useful to sort of actually hear from clients, carers, families, staff, and meet with people to sort of hear it and actually see the day centres as well. Related to that, there's been a lot of work around Tricuro, and some members would have seen at Cabinet last week we approved the transfer of the Dorset Council share Tricuro, which is the sort of first step to with sort of with Tricuro in terms of sort of regularising our governance and work with Tricuro. So the Health and Wellbeing Board was mentioned at in the last item, and as was mentioned, we had a meeting on the 18th of December and a workshop following that, which I felt was really useful, actually really helpful. It wasn't just a workshop of the Health and Wellbeing Board members, but it was actually other stakeholders and representatives from the health service and elsewhere. The health and wellbeing refresh strategy, I think the feeling there was that I took from it was very much wanting to focus on delivery. There's various strategies around the council sort of vision and strategy, the ICS and ICP strategies, and we don't want to spend ages writing a new refresh strategy. It's very much keep it simple, have a good vision and objectives and actually get on with delivering what a lot of those other strategies talk about. So as well as being then the strategic lead for place-based partnerships. Other activities in recent weeks, actually, I think it was last week, we had an assurance visit by OHID, which I had to look up, the Office for Health Improvement and Disparities, another one of those acronyms. And that was Sam led on that to sort of review our public health services. And I felt that was actually a really sort of useful, positive exchange that we had with people from OHID. There's been, in the last couple of weeks, a CQC inspection of our shared live services, which just came up right at the beginning of January. The CQC made contact, so we'll have to await notification of the outcome of that. I won't comment on that any further. And then in the last week, just you know, if things weren't busy enough with day opportunities and CQC inspections and everything else, then unfortunately a care home group closed down in the last week or so. Which includes one care home in Swanage, where there's a couple of BCP residents, and Delph House in Broadstone, where there are sort of BCP residents there. So the teams are working, they're really busy sort of dealing with that and working out moving the people in that care home by the end of January to other provisions. So yeah, teams right across adult social care and health are really busy on lots of projects and issues that are coming up. So.
Thank you for raising that. I did actually email Betty about it when I saw the news in the Echo that it was closing, and she was kind enough to send me the numbers in terms of the two care homes, numbers of. Just speak a name when you appear. Thank you very much for those figures. Just in terms of the numbers of residents in those two homes, I think what surprised me was how short a notice you received about it. I kind of thought, oh, well, they're bound to be known about it for ages, but really you didn't, did you?
No, we work really well with providers, though, to be fair to the providers. You know, that's not necessarily something that they might have been aware of way in advance. And I'm sure they came to us once they'd made the final judgment and decision. But we work really well with them to move people in the safest, easiest way that we possibly can do. And we're doing that now. And as David said, Councillor Brown, that we're hoping to move everybody by the end of January safely and work with them and their carers and families to do that in the best possible way for everyone.
Thank you very much. Any questions to Councillor Brown? Okay, thank you very much indeed. Then we'll move swiftly on to the forward plan. Obviously, happy to take any contributions, but what I would like to do is just, for the moment anyway, focus you on the March meeting, because in addition to the items that are printed on the paper, we do need to factor in that we've got the day opportunities stuff, which I suspect may take a wee while to get through in terms of our timescale. So I'm really looking at what we could reasonably capture within that meeting, and to try and see if any of it can be put back a wee bit. The bit over the page about update on Tricure, I think that could probably wait, because you know, there is going to be a bit of a review, I think, after the daycare stuff, you know, around its governance and all of that. So I think that could probably wait beyond March. That's just my view. But the other stuff, I think that's probably quite a bit. So you're looking at Louise, that's probably quite a bit to cover in one meeting, isn't it? So where are we with the Home First Integrated Hospital Discharge Programme? I know we kind of talked about discussing that before. Betty, is that how, you know, is that kind of, I'm just trying to work out times really.
Yeah, so I mean, we could bring that to March, or we could defer that, Chair, whichever is easy for committee. I'll be doing that report with my colleague, one of my colleagues from the ICB. But very happy to be guided by members on that. It can either come in March or we can defer it until the following committee. I do appreciate that there's more pressing matters that are up against timescales that might need members' attention more than the Home First. So very happy to be guided by yourselves on that.
Thank you. For the reasons I think we've covered already, if we can incorporate it, I would be quite keen to keep that integrated neighbourhood stuff on the agenda if we can. I could just bore you to death with the right care, right person stuff because I'm on the police and crime panel and that is driving me mad. But don't mind my hang-ups. So are we content then to take to defer the Home First Integrated Hospital Discharge Programme to a future meeting, keep developing integrated neighbourhood and community teams on the agenda for March? Do you think, I'm looking around saying, is it reasonable if it's just a presentation about right care, right person? Could we include that? I'm looking for some guidance. But because I think Gavin Dutfield works for the police, doesn't he? I think he works for the police.
Chair.
Sorry, could I just ask, I mean, I would simply be guided by whether or not that's too heavy for the agenda. I'm keen to hear about right care, right person. I suppose for me, the question is this an introduction to the policy? Is it, I mean, it's sort of outlining what happens in our area or what kind of depth? I mean, because that will then indicate perhaps how long the discussion is afterwards and could give us a guide.
That's a good point, actually, because certainly the discussions that have taken place so far at the police and crime panel have been very much, as you would expect, very much from a police perspective, that they don't want to do this work and that they're looking to health professionals to do it. And of course, one is not unaware of the fact that that's going to place incredible pressure on the system. But if I'm honest, as I sit here today, I don't know who's going to do that work. If the police don't do it, who is going to do it? And that's what I was hoping that we might be able to get some health input about. If the police are only going to give us, well, this is it, then we could probably leave it. But at some point, City, looking at Betty, this is going to land on your door, isn't it? And you're going to be looking to find some resources to help.
Sure, shall I come in? Is that okay?
Please.
Yeah, so I think Gavin, who is our colleague in the police, is the person who will present to committee and has been presenting to various other groups. I think it's really important that this area of work is a partnership. It's a partnership between all partners within our ICS and within our wider Dorset footprint. No one organisation can do this or bring these changes in without the support of one another. And it's very, very specific to those people at the time who may be in need of support due to a mental health episode. So we are working very closely with our police colleagues. But going back to your original point, I think the purpose of Gavin come in when we discussed it at members at chair's briefing was to bring committee, just to bring an awareness to committee about this area and to just bring in some of the factors that are leading on this. I don't think we're in a position to say how this is going to look as we go forward in real detail. What I would say is we are picking this up in a number of different forums and boards where all partners are together. But the purpose of Gavin coming was to bring committee up to speed and to bring some awareness to committee. But we are picking this up in a number of different forums. You know, for instance, it's been to the Safeguarding Adults Board, it's been to our Mental Health Delivery Board, and various other areas where we will work as a partnership to look at how we best do this for those people that will be impacted by it who live in the Dorset area. Hopefully that helped a little, Chair. Thank you.
Thank you, Betty. Louise? Okay. Katie, are you still online, Kate?
Yes,
Yeah.
yes. Yeah,
Could you help?
thanks. Yeah, Chair, I was just to come back in terms of the resources, because you asked, of course, about health colleagues. There is a project steering group, and so there is work being done by that steering group to take it forward, because as Betty said, this has implications across the whole system and partners. So we're just trying to work that through in terms of what does this mean, and what is it that we need to do, the actions that we've got to take in order to implement this in the best way within Dorset. So if the committee wants this on the agenda, then certainly I'll take that back and to the project team, because actually someone within our directorate is project managing this, so that they can be part of that report and presentation. Thank you.
Thanks, Chair. I was just going to say that if that item is just purely an information giving item, then I know that we still need to rearrange the ICB presentation, which we're hoping to hold via Teams in February sometime. I wonder if that item could be added to that. You know, if we could try and put them both together on a briefing session rather than take up committee time.
Yeah, that sounds like a really good idea. We just tripped over, unfortunately, we just tripped over diaries for the presentation from the ICB, but we will get that in the diary at some point. But yes, that's a good idea. Thank you, Louise. Is everybody happy that we do that, Joe?
Just I don't want to be like a turkey voting for Christmas, but I'm sure prior to December or at December's meeting, we did talk about the possibility of an additional committee meeting in February. And I think Jackie might have brought up that we should be looking at the budget specifically. And if we don't do that in February, and it kind of impacts on adult health and social care, I'm not sure we'll be in almost good time to scrutinise that properly before that goes to full council. I wonder if we do need that extra committee session in February. Don't shoot me, but I do wonder if that's something we need to put in our diaries.
We did talk about it, didn't we? I can't remember what happened about it.
So I think all chairs and vice chairs of committees are being invited to the Overview and Scrutiny Board when they consider the budget. Obviously, it's quite a moving picture at the moment, as I understand it, but there could certainly be a mechanism for the committee to feed into you before that before the decision is made at cabinet and before it's heard at Overview and Scrutiny Board.
Yeah, I'm just thinking about the dates in my head, really. What, when we might be able to have sight of the adult social care budget. Betty, have you got any kind of clue about times on this? Oh, I guess what I'm really asking in a roundabout way is 4th of March too late?
Chair, it might be prudent to just refer to Gillian a little bit on that one as well. She'll have more, may have a more up-to-date timeline than me.
Are you able to help with that?
I don't have the dates in my head either, in terms of exactly what will come together when. And as Louise says, it's a fluid picture at the moment.
Budgets. Yeah, Chair, budget setting day is 20th of February. So obviously the reports will come out a week before that, which is So that's what, probably about Monday, the 12th of February, I think the papers will come out. And I know there is obviously member engagement taking place. But I suspect it's probably when the figures come out, actually it'll be coming out before that, because it's to go to over the scrutiny board, isn't it?
When's it go to ONS, David?
I've just checked the dates and it's the 29th of January. It's going to the Overview and Scrutiny Board.
It's a good point, Joe. We're just trying to think about dates. Thank you.
For my 2 penny worth, I think Monday nights are when we do stuff. My gut feeling is that we pencil in 19th of February at 6 o'clock. We'll be here and we'll probably be scrutinising the budget. It'll be fun. Yeah, I don't see a way of avoiding that.
Louise?
On the 6th of February, I turn 39, so I'd like to party. Oh, we could do the 5th or the 12th. 19th just seemed, yeah, I have picked that very much out the air, but I think, isn't it, the budget comes out on the 20th, so we can see it the week before, so it's not out until the 13th for us to gander at. So does that mean we've got to do the 19th? Or could we look at it beforehand? I'm still crap on how the council bureaucracy all fixed together, to be honest.
Well, if Overview and Scrutiny are seeing it on the 29th, then we've got between then, haven't we, and the 20th of February to fit something in. Is
that the consensus of the committee, that you'd like an additional meeting to look at the budget? If it is, I can go away and look at all the timescales and come back to you.
How do people feel about that? About trying to feed another meeting in to have a look specifically at the budget. Shall we see what we can do regarding dates?
Actually, sorry, we've got a budget workshop, all member invitation this week on Wednesday afternoon. Yeah, maybe raise it there and try and clarify the best route for scrutiny committees to feed into the actual to the.
Okay, yeah, no, that's a good suggestion. Thank you. Okay, we'll look to try and do something and fit something in for the committee to take stock of the budget for adult social care between now and the 20th of February. Yeah. Thank you for the reminder, Joe. I'd forgotten. Okay, anything else on the forward plan? I guess I just wanted to say that obviously we will pursue the issue of the ICB briefing, but I think we've established already with the work of this committee that there's a massive amount of work to get through. So I've kind of rather sneakily resorted to putting it or getting Louise to put some stuff through via email. So we sent round the winter plan, which Betty was kind enough to send out. So really just so that so that you're alight, so you're aware of it. Obviously we haven't had the chance to scrutinize it, but what I was wanting to do was to give you the opportunity to have a look at it, and then if there were any queries, then we could feed those into Betty to have a look at outside of the normal cycle of meetings. So when opportunities like that come, I think Betty would probably prefer just to have a look at it properly, but there's just so much to do. And the other thing to mention, I think, while we're just looking at this stuff, is again, Louise has circulated recently some new guidance from the government about scrutiny of health services. So this is around major reorganisations in healthcare services. So this is the big stuff, and in a way, this refers back to something which was on our forward plan, which was to look at the difference in definition between what was a major reconfiguration in Dorset and what was a major reconfiguration from the BCP point of view. But long story short, Louisa kindly circulated that bit of paper. So when you're, feeling a dose of insomnia, have a read of that. But it is interesting bit of work, I think, to slightly kind of refocus how that scrutiny of the health services is going to work in the future. And obviously, if anybody has any questions, I absolutely no idea what the answer to is, but I know a man who does. So that's that. The other thing, again, apologies to Kate. I have had some exchange of correspondence with Kate about pharmacies, mainly because I couldn't get my brain around the fact that, on the one hand, a lot was being said about the just the kind of role of the pharmacy and the increasing role of that, was being expected of pharmacies in helping with healthcare delivery. But at the same time, there appeared, and it might just be me going slightly mad, but there appeared to be a reduction in the number of pharmacies that were actually operating. I've had a couple of people, contact me with concerns about individual pharmacies closing. Now, I have no idea what's going on there, but I kind of rather cheekily asked Kate if she did. and she agreed to have a look. Is that all right? I'm not disrespecting her or anything, am I?
Not at all, Chair, and happy to, if the committee feels that they'd like us to bring back an update similar to what we did with, of course, general practice access and dentistry, we're happy to do that.
Okay, so we're everybody happy that we're okay with the March meeting? And is there anything else anybody wants to flag up on the forward plan? No? Are we all okay then? I didn't quite make 2 hours, Joe. 15 minutes. Well, anyway, thank you very much indeed, everyone. Thank you for your time. Thank you, the other side of the screen. Thank you.